Hello, my name is Valerie Cordero, and I am Co-Executive Director of Families for Depression Awareness. Today, I am thrilled to be speaking with Dr. Morgan Saulsberry, who is going to discuss her research on genetic testing for the treatment of depression in Black and Hispanic patients. Dr. Morgan Saulsberry is a medical science liaison for Myriad Genetics Neuroscience, where she provides education and scientific support on pharmacogenomics and the GeneSight psychotropic report. She received her Bachelor of Science in Biology at Mercer University in Macon, Georgia, where she also received a minor in chemistry and communications. She then went on to the University of North Texas Health Science Center in Fort Worth to receive her Doctor of Pharmacy degree. Dr. Saulsberry recently co-authored a study on the impact of pharmacogenomic testing on Black and Hispanic patients living with depression. Hello, Dr. Saulsberry, and welcome.
Hi, Valerie. Thank you for having me.
So I gave a little bit of your background, but would you like to talk some more about your professional experience?
Sure, yes. I've been with Myriad now for about 2 years, so I've just spent a majority of my time as a medical science liaison, just communicating with providers and physicians on how they use GeneSight and providing education about pharmacogenomic testing.
Okay, and you recently gave a presentation, didn't you, at APA?
I did. I recently
Say what
presented.
APA is, maybe in case people don't know what APA is.
Yes, it's the American Psychiatric Association. And so they have a whole conference every year where they have all their providers come and they talk about different things in depression and other disease states. And so I actually presented this paper while I was there.
Okay, excellent. We're going to get to the paper in a minute, but we have not a whole lot of understanding in the public about genetic testing, maybe some misconceptions. Can you just talk about what genetic testing is and how it relates to depression treatment, or how it can relate to depression treatment?
Yes, I can definitely do that. So pharmacogenomic testing, what it is it's a simple cheek swab that we do through GeneSight. And how it works is it gets sent off to our lab in Mason, Ohio, where the DNA is run. And basically, your provider gets this report that's generated, and medications are sorted into different categories based off of that information that we got from your DNA. But what it's basically showing us is how you may respond to medications, and then also how your body may be breaking down those medications. And so it's just more information that your doctor may not have, but can get by looking at your pharmacogenomics or your genetics.
Okay, that's helpful. Pharmacogenetics, it's a bit of a hard word, but it basically means how your body responds to different medications. Is that correct?
Responds and breaks them down, yes.
And breaks them down. Thank you so much for those of us who aren't in that medical field. So we referenced this study that you completed with your fellow researchers. And for everyone who is interested in learning more about that study, we are providing a link in the video description. And it's a link to a one-page informational sheet about all the statistics and the information and the way they completed the study. But why did you all decide it was important to look at how genetic testing can improve health outcomes for Black and Hispanic patients?
Yeah, so when you're using any sort of scientific tool, it's important to know if that tool is both accurate as well as effective. And so we had actually done a study called the guided study, and we looked at symptom improvement, response, and remission in all sorts of different populations. And we were able to find some really good things from that. We were able to see that patients are able to respond better and have better remission rates when their clinician had access to pharmacogenomics or genetic results. But the issue with that study is that a majority of the cohort or the majority of the population was actually Caucasian. And so we thought it would be really important to look at how those same results basically factor out in more minorities, so in Black and Hispanic patients. And so that's why we decided to do what we call a post hoc analysis, basically just taking a second look at that same data, but looking just at that specific population of Black and Hispanic patients.
And when you took that look at at those results with Black and Hispanic patients, what did you find and why are those findings important?
Yeah, we found basically two main results. First, when we looked at patients who are on significant gene-drug interactions, so basically medications that would fall in that red category on our report, we saw that those numbers really didn't differ from the overall population in terms of how many people that happened to. So that's good news. It just means that it's as expected. There's no differences there. And then the second thing we saw is that when we looked at the same endpoints of symptom improvement, response, and remission, that we were able to see that regardless of race or ethnicity, if your clinician had access to those genetic results, then you were able to see better results than for the patients that didn't have access to those pharmacogenomic results.
Okay, and you mentioned before when we've talked about this that it's harder sometimes to get Black and Brown people to participate in studies, and I know in clinical trials that it's sometimes challenging, and that reticence comes from historical injustices with the healthcare system, and while they may be rooted in real issues, it can sometimes impede some of the progress we want to make. So can you speak a little bit about why you think Black and Brown people are more reticent to participate in studies or clinical trials, and maybe what can be done to overcome that?
Absolutely. I think it is rooted a lot in that mistrust, as you just mentioned, from what we've seen historically. However, it's good to know now, we have a lot more regulations in place, making sure that studies are done in an ethical manner. And then right now, I also think it's probably just a lack of awareness. Maybe you don't know that there's trials available that you can participate in. So it's good to take some initiative. You can ask your primary care provider or any provider and say, hey, I'd like to participate in a study. You can search online. There's lots of different resources available.
Yes, and this is important. Why should Black and Brown people be doing this?
Yeah, it's important because
Why
we
should
want to
we
make sure that the tool works for us, right? Not just for one set of the population. We want to make sure it works for everyone. So it's very important that minorities participate in the study so we can make sure that it's effective for everybody.
Absolutely. Why is this work significant to you? Why is what you do important to you?
Yeah, it's significant because being Black myself, I want to make sure that if I took a genetic test, that it could be applied to me and that that information would be accurate. And then also, the whole pandemic, we've all been dealing with mental health. And so I think it's really important that we partner together and realize it's not just one person's issue, it's something we all deal with.
Thank you for that response. And what is your takeaway message to BIPOC families in which one person might be living with depression? What do you want to tell them, and what hope can you give them? What would you say to those families?
I would say that it is okay to ask for help. And if you have a family member that you don't know what to do about, maybe they're going through these issues, look online. There's a lot of great resources. You can also talk to your primary care provider. That's the number one thing I'd suggest because they're going to have a lot of resources for you. So again, don't be afraid to start the conversation.
Thank you so much, Dr. Morgan Saulsberry, for sharing your expertise, and thank you to everyone who's been watching today.